Disclaimer. While we may act like we are trained professionals, we are not, so communication is not always going to be completely therapeutic, so please disregard any inappropriate head nodding or phrases.
Hey Julia, how are you?
I'm okay.
What's going on?
I'm just studying about therapeutic communication.
Oh.
Yeah, I'm not really getting it.
Really?
Yeah.
Well, I think I can help you out with that.
Really?
Some of your classmates are going to give us some examples to help us learn more about therapeutic communication.
Okay.
Let's go.
Okay.
Whatever happened to predictability? The milkman, the paper boy, evening TV. Did I get delivered here? Somebody tell me, please. This whole world's confusing me. Clouds as lean as you ever seen. Ain't a bird who knows you're true. Then a little voice inside you whispers. Everywhere you look, there's a heart, a hand to hold on to. Everywhere you look,
Mima, wake up!
What are you doing in my room?
Wow, what a great place to start. What did you notice about how this nurse handled getting up this Alzheimer's patient?
I feel like she was pretty rough and not very kind and considerate, considering it was early in the morning.
That's a great observation. When working with dementia patients and people with Alzheimer's, it's very important to remember that you want to approach with a smile and make them feel safe in your presence. Let's take a look at how you can better handle this situation.
Okay.
Hey Mima, good morning. How are you doing today?
Oh, so good. How are you?
I'm Allie, I'm gonna be your nurse for today.
Okay.
We've got breakfast.
Breakfast.
And I've got you a coffee to get you ready to go.
I need some coffee.
And before we do that, do you want to wear your green or your blue muumuu today?
The green muumuu. It brings out the color of my eyes.
Beautiful. I'll go grab it right now.
Oh, thank you.
Wow, that was a lot better. What did you notice this time around that the nurse did differently?
I noticed the nurse was a lot more kind, respectful, help her feel excited and ready for the morning, giving her a choice of what she wants to wear, telling her about breakfast.
Yes, she demonstrated a great way of communicating with someone that has Alzheimer's.
So, tell me how your eating habits have been.
Well, I just feel like I've gained like so much weight recently. So, I mean, they haven't been the best. I just like don't like what I look like, you know? Like I just feel huge. You know? Have you ever felt like that?
Not really.
No? Okay. Yeah.
Why'd you stop talking?
Okay, what did you notice about this situation?
I noticed that the nurse was very quick and she seemed very judgy, and the patient was just feeling really uncomfortable and like she wasn't being listened to.
Exactly. When we're communicating with patients, it's really important that we give them room to talk and explain their feelings. And with how the nurse addressed this patient when she asked why she stopped talking, it shut down communication between them. So let's take a look about what a nurse could do in a situation like this.
So tell me about your eating habits.
Well, they probably haven't been as good as they should be. I just feel like I'm gaining a lot of weight and I don't like what I look like. But
Okay, tell me more about that.
well, I just have never really talked to anyone about this.
Alrighty, that was a lot better. What did you notice that the nurse did differently this time around?
This nurse was a lot more kind and she seemed to really care and want to understand the way the patient was feeling. And the patient seemed a lot more open about how she was feeling.
Yes, exactly. The nurse did something where she observes maybe a feeling or something the patient's doing and then asks the patient about that. She was addressing that and allowed the patient to further elaborate on her feelings, which then allows us to better communicate with the patient. Another thing I wanted to outline is when the nurse said, "Why did you stop talking?" Why is a big word that we want to avoid. A lot of times it feels like we're attacking the patient or demanding an answer from them. And so, in any type of communication that you're doing with patients, try not to use the word why. So that way you can create a safe, non-judgmental environment for them.
But why?
Oh, it's you again. I thought I'd be seeing you soon.
I'm sorry, I just feel like such a failure. I try
Yeah.
not to come in, it just happens.
Mm-hmm. Yeah, I bet. So yeah, what are you in for this time, huh?
Oh, my stomach was hurting me again. I don't know what's going on.
Well, it says here in your chart that you've been taking a lot of Percocets. Does that sound right?
I don't know what you're talking about.
Well, I'll just make a note of that. And is there anything else I can do for you? Okay. See ya.
Whew, that was a bad one. What did you notice wrong with this situation?
Like everything. The doctor is rude, the patient was sad, and just everything was a mess.
Exactly. I don't think I want to say anything more about how horrendous that was, so let's take a look about what you should do in this situation.
Hey Johnny, how are you?
Hey, Doc. I'm not feeling the best and just upset that I'm in the hospital again, you know? It's like my family, they look up to me as their supporter and this big, strong guy, and I feel like I let my family down.
Johnny, we're here for you, okay? No matter how many times you come in, we'll help you get better, just like we did last time, okay?
Thank you, Doc.
Alrighty, what did you notice about how the doctor acted differently during this scenario?
The doctor was a lot more professional, and he seemed to really care about the patient and listen to his concerns. And he kind of was quiet to let the patient continue to talk about how he was feeling.
Yeah, that's something that we call therapeutic silence. Therapeutic silence is something really important to have in your toolbox. It allows the patient time to think about what they're feeling and what they might want to say. So in moments when you would normally cut them off and they couldn't elaborate on their feelings, you remain silent, and that gives the patient the chance to elaborate on their feelings, and you're more likely to get better information out of them when you allow them the time to speak their feelings.
That makes sense.
Hey Mrs. Smith, how are you doing today?
Oh, not great.
Not great? Oh man, I'm sorry to hear that.
Am I doing worse?
No, you're looking great. I think you're actually even getting better.
Alrighty, what did you notice about this scenario?
I noticed in this scenario that he's kind of saying some things that might not be true. Like, how does he know she's going to be fine? And I feel like he wasn't really paying attention to how she was feeling.
That's a good observation. He was doing something that we call false reassurance, which is something we want to avoid. In a lot of situations, it's really easy to tell the patient, oh, you're going to be okay, you're going to be just fine. But we don't want to do that because we can't promise that. And so that's a great example of what not to do. So let's take a look at what you should do in this situation.
Hey Mrs. Smith, how are you doing?
Not great. Am I getting worse?
Well, how are you feeling?
Tired.
Really tired. Are
Yeah.
you in any pain at all?
I don't think she's been herself. She's been super unresponsive and like not eating or anything.
Yeah.
Well, that took a turn for the worst, but what did you notice about the communication at the beginning of this scene?
I noticed that instead of telling Mima that everything's going to be all right, he asked her more questions about how she was feeling and about her pain, and trying to really just be there for the patient.
Yeah, exactly. He did a really good job of not using false reassurance and asking the patient how she was feeling so he can get a subjective opinion on her and how she's been feeling.
All right, it looks like I have some pretty bad news. You have gonorrhea.
Gonorrhea? I don't even know who she is.
I'm so scared. I'm gonna go get the doctor.
Alrighty, what did you notice about this situation and communication?
Well, I thought it was interesting how the nurse gave the diagnosis because I thought doctors were supposed to do that. And then instead of talking to the patient about the condition, the nurse kind of was just like, oh, let me go find someone else, which I thought was kind of like irresponsible.
Exactly, there were definitely two red flags in there. First, when the nurse gave the diagnosis, because it's the doctor that always gives the diagnosis. And second, when she said that she was going to go and get the doctor. When patients have questions, we want to try and answer them the best that we can. And this is something that we call passing the buck, which is when you throw someone else under the bus, or say you'll go get someone else to answer a question that you could sit down and talk with the patient about.
Hey Kimberly, I'm Dr. Jean. I just wanted to give you the results real quick for your STI screening. It indicates that you have gonorrhea, so I'm gonna go put in some orders for some antibiotics, and the nurse can talk to you a little more about that, okay?
Okay.
Doctor, who's gonorrhea?
I'm so scared.
Tell me a little more about what's frightening you.
Alrighty, that was a lot better. What did you notice that was different this time around?
I noticed that first of all, the doctor gave the diagnosis, and then the nurse was a lot more kind and considerate in answering her questions the best she can and addressing her fears.
The patient stated that she was really scared, and so it was great when the nurse took the time to kind of dig into those feelings so that she could talk more about why she may be feeling that way and help her move forward.
Hello, Michaela.
Hey.
I heard you wanted to start using some contraceptives, is that right? Okay. Well, I need to do a little assessment before we can pick one out for you. So tell me, do you have any kids?
No.
No? Okay.
Alrighty, what did you notice about communication in this situation?
I noticed that the nurse really didn't give the patient time to really elaborate. I feel like it was a really like cut and dry yes and no kind of answers.
Yes, great observation. Yes and no questions are something we want to try and avoid because it doesn't allow the patient to elaborate more on what they're thinking and feeling. So in this situation, when he just asked, how many kids do you have? It was just a simple yes or no answer. But what if there was more that she needed to say about it, but wasn't allowed to because it was just a yes or no answer? Let's take a look about how this could be handled.
Hello there, Michaela. How are you?
Good.
Good. So I heard you wanting to start some contraceptives. But before we can get into that, I'm just going to ask you a couple questions. But so tell me about your family.
Well, it's kind of complicated, I guess. I've been pregnant before, but I lost them, so I don't know if that really counts.
Oh, I'm sorry to hear that. But yeah, I'm sure we can figure this out and we'll help you through the process, okay?
Thank you.
That was a lot better. What did you notice about communication in this situation?
I noticed that the nurse asked better questions so that the patient felt like she could open up more about things that might be challenging to talk about.
Exactly. The nurse did a great job of avoiding yes or no questions. And then with the question that he did ask, the patient was allowed to elaborate more on the kind of her family structure and something that she might not have brought up if a yes or no question had been asked. Great observation.
Hey, so it looks like we are going to be admitting you.
Really? I'm so nervous. I don't think I can do this.
Oh, honey, you got hips that can birth a baby elephant. You'll be fine. You'll be fine.
Yeah, I'm sure you'll be okay. Don't even worry about it.
Wow. What was something you noticed about communication in this scenario?
I noticed that the nurse was kind of short, and I think she used something that we talked about before, false reassurance.
Yes, exactly. That was a great example of using false reassurance. You want to avoid saying something that might not be true. And so that was a great example. Now let's take a look at how you could handle a situation like this.
Hey, so it looks like we are going to be admitting you.
Really? I'm so nervous. I don't think I can do this anymore.
Oh, honey, you got hips that can birth a baby elephant. You'll be fine.
It sounds like you're pretty nervous about giving birth. Can you tell me more about your worries?
Well, I don't know if I've got hips that can birth a baby elephant.
That was much better. What did you notice that the nurse did different in this situation?
I noticed that the nurse was a lot more therapeutic and good at answering her questions and making her feel comfortable, even though the patient was really scared, without giving false reassurance.
Exactly. The nurse did a great job about prying more into what the patient was feeling and asking a question that allowed the patient to elaborate on her feelings during this time. Wonderful.
So how's your mood been since you gave birth?
Honestly, some days I really just want to throw my baby across the room.
It sounds like you have quite the temper. Like, we should probably get you into therapy, because that's not great.
Well, that was quite the interesting scenario. What did you notice about the communication that was happening in this scene?
I noticed that the nurse was seemed rude and really judgmental and not very caring for the patient. It made the patient feel really insecure about how she was feeling and just kind of horrible altogether.
Exactly. The nurse was casting a lot of judgment, and you could kind of sense that it was making the patient uncomfortable. So a lot of times we'll make statements that are judging towards the patient, and that is a way that blocks off communication immediately. So we always want to refrain from judging the patient. We want to have unconditional positive regard towards them and their health.
Tell me, how's your mood been since you've given birth?
Honestly, sometimes I feel like throwing my baby across the room
Do you worry about losing control sometimes?
all the time.
Alrighty, that was a lot better communication. What did you notice that was different?
I noticed that the nurse was a lot more caring and asked open-ended questions so we could really get to the bottom of the mother's concern.
Exactly. The nurse did a great job of asking a question that allowed the mother to further elaborate on those specific feelings that she was expressing concern over. Alrighty, let's go over some things that we have learned.
Okay, we learned about passing the book and addressing the patient's concerns while we're there and not giving it to someone else. We learned about not asking yes or no questions so they can be open-ended and the patient can further explain how they're feeling. We learned about not asking why because that limits the stuff that they can talk about. We learned about not being judgmental so the patient feels comfortable to share what they are feeling and any concerns they have, and they feel comfortable to share more with you as a nurse. And we learned about false reassurance, not to say things like, oh, it's going to be fine, when we can't promise things that we don't know will really happen.
Wonderful. Thanks for coming along this journey with us. We hope you learn more about therapeutic communication. About this scenario with the nurse. Cut. Preston!
She like looked up and was like, she opened her eyes.
Wow! Action.
Hey, Kimberly.
That was lots better. What did you notice about this? Okay.
Getting it on your skin purposely so that it turns red.
Rude.
Hey, babe, you got hips that can birth a baby elephant. You'll be fine.
Well, that took a turn for the worse. My Meemaw rest in peace. Is that appropriate?
Wait, sorry. Sorry.
Time of death, 1543.
Wow, this is terrifying.
A little laugh. Hit it. Scream. Ah, Kyler, you're feeling sick. Wait for it.
Spirit activate! Holy Spirit activate! 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 Okay, ready?
At first I was afraid, I was petrified. Kept thinking I could never live without you by my side. But then I spent so many nights thinking how you did me wrong. And I grew strong, and I